So how can you help someone with cancer? Listen. If you don't know what to say, that's okay. None of us have all the answers. If you can just listen and be present for that person. There's no need to offer advice or opinions unless the person is asking. So unsolicited advice is often generally not really accepted, unless somebody actually asks you, and wants your opinion because they value what you have to say. And it takes the pressure off yourself, just so you can just be there for them and be present. Try and plan in advance to prevent last minute emergencies. You can't plan for every situation, but if there's certain things that may come up, or certain things that you're thinking about, then that may be a good time to talk to somebody about it. For example, we have individuals that may live on their own, and their support network may live nearby, or they may live in another town, or they may live in another province, or even somewhere else in the world. So if they live alone, then planning for such things as a personal alarm may be helpful for that person, so that because they live alone, if something happens and they have a fall, or they're in distress and they need help, then they have the personal alarm, and that automatically will go to 911, and then they can be linked up with the appropriate services. You can create schedules and then delegate what you can. So oftentimes in some families, some individuals are very good at planning schedules, keeping track of appointments, especially for people when they're going through treatment and they're not feeling well. So to have somebody there just to be able to keep track of when their next appointment is with the doctor, or when their next treatment is. And if you can plan that and try and have the same individual as much as possible attend, like especially the appointments with the doctors, then the same consistent person is hearing information and can then review that and discuss it after the appointment. There's sometimes in a group of caregivers, there may be somebody who is, very tech savvy, and they can send out an email with an update on how the individual is doing. So that person doesn't have to remember to call 6 or 8 different people and talk about the same thing repeatedly. So that way, one big general email can go out and everybody gets the same information at the same time. Ways to help also with communication. So it may feel awkward to talk about certain things, but talking about shared concerns may give you and that person more support. And oftentimes what we find is that, one individual may feel that it's awkward, but actually it's a topic or a discussion that the patient is also feeling. It's just not been verbalized. So it's not out on the table and people aren't aware. So sometimes, just asking a certain question or talking about a specific topic can allow for more openness and honesty. Having good communication avoids making rushed discussions. So you can actually schedule a time to have, to talk about things and to discuss things further. So after, say, for example, if somebody's had a treatment and then for the next 3 days after their treatment, they don't feel very well, that may not necessarily be the best time to have a discussion about something that's really important or critical. So maybe after, when they begin to feel better, and their counts have improved and they don't feel as tired, then that may be a good time to kind of schedule something. And you can say, oh, how about I give you a call on Thursday afternoon, or I could come over and make a cup of tea and we could sit down and discuss this. Review expectations and needs on a regular basis. So within the healthcare system and within treatment, things can change, and they can change very quickly, unfortunately. So knowing as a caregiver what the person wants and what their wishes are is very, very important, so that you can advocate for them as necessary. And you can just be clear and kind of maybe remind them at different times that, well, we've had this discussion and you had said at that time, this is what you wanted. Is that still remain the same, or have you changed your mind? So reviewing those expectations and having those conversations on a regular basis can really help. And consider writing a letter. So if you find it hard to actually talk to somebody about it, about certain topics or expectations, as noted, then maybe writing a letter could help, or taking down point form notes so that when you do meet, you can be clear and you know that you've addressed all the issues and the concerns that you wanted to make sure were addressed. And then it gives the patient or the individual an opportunity to be able to add to that or respond accordingly. Talking. So you may feel awkward, as we said, and that's okay. There's no perfect words. So you can try something like, what's on your mind, instead of how are you feeling? Because then you might just get okay, I'm fine. And then the conversation sort of shuts down at that point. Try, I'm thinking of you, or I'm not sure what to say. Just know that I'm here and I care. Ask the person about their treatment wishes and respect them. Ask what the person may need assistance with and allow them to do things for themselves within safe limits. And learning that there are many different types of cancer. So learn about theirs. So when you come to appointments and if you join them in doctor's appointments, you can ask them, you can ask the doctor or the nurse for written information that you can take home and review, or you can ask, if you're tech savvy, you can ask for specific websites that give accurate, up-to-date information especially about healthcare in Ontario. So you can get information in many different ways, and respect that the individual may or may not want to know a great deal of information about their cancer. So we see a lot of people that, come from various thoughts. Some individuals want to have all kinds of information and want to be well prepared and knowledgeable. And other people say, no, I'm not ready for that. I don't want that. Or they give permission for us to speak to their family or their caregiver. Don't assume that they know it all or you know it all. And cancer can affect everyone differently. Anticipate changes in how they look and act. So they may, in terms of looks, they may lose their hair, depending on the type of treatment that they're having. They could lose some weight or gain weight, depending on certain medications and the treatment. And fatigue is often a very common side effect in terms of how some people feel. And really just trying to put yourself in the person's shoes and follow their lead. Spending time. So finding the right time to spend quality time with them. Don't take it personally if they're not up to it. Try to be present when you are with them and appreciate that time. So even if it's just 15, 20 minutes, or it could be a whole afternoon, depending on how they're feeling. If you don't live with them, keep offering to visit or call even after hospital discharge or after a treatment ends. And just schedule time for socializing. So just some general fun that, getting together and just updating them in terms of, maybe your life or your family and perhaps your children or, other people that you're close to and other people that you both know. And just schedule some time just to be together, not to necessarily have to talk about their illness or their treatment, but to talk about other topics of interest. Allow emotional space. So allow time for them to be sad or upset, but don't be afraid to laugh and have fun with them. It can be tempting to try to cheer people up by saying, you'll beat this, stay positive. But be careful of providing false hope or promising things that cannot be delivered. It can really help just to listen, even if what they're saying is upsetting to you. If it's hard to talk about something, say so and offer to talk about it at a later time. Let them cry. Tears are a natural human response. And I always say in the social work world, if you're not crying or don't have any kind of response, that's when I have the most concern, because it means that you're generally holding all those thoughts and feelings inside, and it can cause, some significant depression and anxiety. So how to help somebody with cancer? Be specific. So be specific when you can offer help. So for example, I'm going to go do errands. I'm going to the grocery store. Can I pick up something for you? Is there something that you're really wanting? Maybe they want some ice cream or a specific type of tea. Or can I pick up some prescriptions for you? Some individuals use smaller pharmacies that don't have a delivery option. So can I pick it up for you? Because I'm going to be driving right by, or I'll be in that neighborhood. Or you can be very specific and just say, especially now at this time of year, I'm going to come over and just shovel your driveway. Or I always say, feel free to come over and clean the toilet, because nobody likes to do that job. I brought you a meal just to heat up for dinner. So something very simple, and it can be just left in the fridge. And then when they're hungry, they can just take it out and warm it up in the microwave. And if you're sick yourself, please kindly stay away and use virtual methods to connect with people, because your immune system is low. And it's the last thing I think that we would want to do, is to share germs and have them get sick in some other manner, especially at this time of year when, there's lots of different strands of flu and RSV, and we just want to make sure that everybody stays safe. And reach out to the caregivers. So this is for other family members and friends. So caregiving can be exhausting. So if you're not the main caregiver, find out who is and offer support to that person. Helping with meals, outdoor maintenance, and rides can go a long way. So kind of making it from a team approach can be very helpful and appreciated.